Over the past several years, few issues have sparked such national debate as healthcare reform. With rising healthcare costs and a growing percentage of uninsured, our society has struggled with finding solutions that we can all agree on, and that unite us as a nation. While this debate carried on nationally, one community has come together with a healthcare solution of its own. Seeing a growing population of uninsured and underinsured, and a hospital ER overtaxed with a growing number of non-emergency patients unable to pay for services, the United Way of Hood County has come up with a simple yet unique concept of taking care of the healthcare needs of the underprivileged of its community. Ruth's Place Clinic.
There was a group of individuals in Hood County who had a dream, and the dream was of starting this free clinic. And so together with United Way, we formed a collaboration. And the thing I'll say about United Way is that they've always been visionaries. They see what is needed in the community, and then they know what to do to help that come to fruition.
Well, Lake Granbury Medical Center has been very involved in the community and also with United Way. And we looked at Ruth's Place as solving a need in the community that we hadn't seen as much of a resource for before.
The Hood County Hospital District early on saw the advantages of a free clinic such as Ruth's Place to fill a void, and a growing void, in healthcare delivery in Hood County. It was a need that we could not fill as through the hospital's Industry Care Center, and we felt that it would additionally take somewhat of a load off the emergency room at the hospital so that they could handle more critical cases. It was truly a win-win for us and for Hood County.
I work in the emergency room, and so I see kids all the time that come to the emergency room because they don't have access to care for routine complaints or for medical problems that wouldn't have gotten bad or required going to the emergency room if they'd seen someone earlier. That's one of the reasons that my wife and I wanted to do this so much.
We're filling a void for patients who are in their process of transitioning. Either their Medicaid has lapsed and they're trying to reapply for it, but they're caught in a short period of time where they need help, and we're able to keep those kids out of the emergency room.
An average emergency room bill for a simple problem is $500 to $800. Anything more than that can easily exceed $1,000. And with the hundreds of children that we see here every year, I mean, that would add up, not just to the parents, but most of those bills go unpaid. So for the community absorbing those costs as well.
We had this wonderful collaboration between the Hospital District Board, Lake Granbury Medical Center, the Ruth's Place organizers, the United Way, the volunteer doctors and nurses, and local businesses and churches. And they all came together for this one thing, was to get Ruth's Place open so that we could serve those people.
Operated by a volunteer staff of doctors and nurses, Ruth's Place opened its first clinic in the Oak Trail Shores community, primarily to serve the needs of uninsured children.
This area here has got so many challenges, and we wanted to help out. How can we help fulfill one of those basic needs, and that's just plain old health care, which is so needed in this community.
The patient comes in, they're sick, we see them, we take care of them, provide the health care they need, the medicines, and that's it. And so we get to do what we got into medicine to do.
A lot of people that can't get Medicaid, don't have insurance, don't have a job, they can come here. They get the help, they get the programs that they need.
Ruth's Place is really there as the very last safety net for a lot of people.
When people have no insurance and no other place to go, then we're here.
So Ruth's Place was started to address that. But then you look and see what else is going on. And we could have been proud just in fact that we got some health care for the people that really need it here. But now we're working in conjunction with the First United Methodist Church. We got a food pantry. So besides health care, we now have a food distribution.
We were serving at one time over 130 families out here, which is quite a bit, quite a bit of people.
We've got the Healthy Kids program here, feeding kids and during the summer months, giving them a place to come and stay.
If this program didn't exist, they wouldn't have a lunch. And it's a great time for people to make a difference in their lives as well. Not only are you giving them a meal, but you're giving them a hug, you're giving them a smile, you're showing that someone cares.
We have Star Council here working with kids here in a summer program, which helps to target substance abuse.
Star Council has partnered with Ruth's Place in the United Way in Hood County to come out and give some character education classes and provide some fun activities to the youth as they come and get their lunches out here at Ruth's Place from the healthy kids. We read books and tell stories and talk about dreams and feelings and goals, and
basically character building, how to make decisions, how to make healthy choices.
Because if a child has self-esteem and the ability to feel good about themselves, and they learn to say no in appropriate ways, and they learn to deal with their feelings, then they're better able to stay away from substances and abuse those.
We've got other organizations helping out, putting in parking lots and playgrounds. We got a new building established here.
One of our members found out about a need for just some square footage, some space, so the kids could be able to meet and have lunch in a nice building. And so that particular member decided they wanted to donate their time and resources to be able to put together this building to have a place for the kids to be able to meet. Another thing that we even did in just preparation and partnership with the Optimist Club is we needed to clear some land to be able to prepare for a playground.
We brought out equipment, and about 3 or 4 of us cleared the lot of trees, and then we had a couple hundred people come out and take off the brush and haul it away.
To be able to partner, as I said, with the Optimist Club so that they can build a playground so kids can have a safe environment to come and just know that they're loved and cared for here at Ruth's Place.
You can see the communities just come around and help support this. They think it's a great idea, and we've taken what was a kind of a small concept with a great need, and it's just taken off on its own, and I'm so proud, so happy to see so many good things happening here. It's been just a great thing.
This is a truly community-driven, grassroots effort, and it's just something that is very rare in the country. It's often services for families are driven by professionals, and the decisions are made by professionals, and they don't always know what it is that families need. So it's just a breath of fresh air for us in the Hand in Hand initiative to be able to see this truly phenomenal work that Ruth's Place is doing.
We like to think of Ruth's Place as a place of hope. And that's the way you can change a neighborhood, is to bring hope.
The spirit in which they approach each day, it is instead of being hopeless, hopeful, that maybe things are changing and will change.
I think it's changing the neighborhood. You know, crime rate's been down out here.
I can see it in the neighborhood. The neighborhood's perked up. It's a proud neighborhood, and the people are getting served here. You can just go around back and see the people getting food, getting medical care, and it's got to be good.
And they're excited about the opportunity to live a life that is able to make a difference even themselves.
I've been wanting to volunteer for a long time. There are so many people out here that needs food. I'm myself, I receive food from the food pantry, you know. We have a lot of low-income people. Jobs are hard to find now. We volunteer. It's like giving back to the community.
And to see a community that's willing to have their needs met in such a way that they're willing to turn around and meet other people's needs, I believe that's when we're going to begin to see a big change and a big turnaround and seeing lives change. And so that's probably been one of the most encouraging things, is to just talk with residents that are now hopeful and excited about all the things that are happening within their community.
If you just look at the volume of people that have come and used Ruth's Place, that's data. That shows you something, and we're driven by data. But when you also hear the stories and the impact it's had on people's lives, and the way that Ruth's Place is able to help people move forward, get back on their feet, and take control of their lives, that's as impactful as the data.
This grassroots effort has expanded to include a Crawford Avenue clinic to address adult health care needs, and it's all because of a caring and compassionate community that has come together to meet these needs.
Well, I have a caregiver. She kept talking about Ruth's Place. At about August, I decided to go out and look for myself one of the days that they were open. I could see the need and how the doctors were operating in a 12 by 60 mobile home that was beyond any comprehension. And I thought, well, if these good doctors can volunteer their time, maybe I can do something. I went home and talked to Mary Jo about it. Mary Jo is my wife. And I said, these people really need help. I said, what do you think about helping them? She said, well, I think that's a pretty good idea. We got a facility here that we can expand. We've got some good doctors that are volunteering their time because there is a great need for their services for the people that are deprived.
There's a crying need within Hoods County for services. If you talk about children, which is where Ruth County started, they've done a tremendous job in getting most of their children on Medicaid and getting help from them that way. Where I see the biggest problem is, what about that group from 18 years old to 65 that do not qualify for Medicare, do not qualify for anything that Hood County may have to offer? That's the population that you can probably make the biggest impact on with regards to intervening with medicine and controlling their problems. And yet that whole area is probably the least served in Hood County.
The adult clinic is so full of people. There's a huge need for it, and they're getting the word and they're coming.
The ladies will come in for routine annual exams and pap smears. We do breast exams, and we can refer them for mammograms.
My function as a volunteer is to be the medical doctor for the adult population who qualify to come into Ruth's Place, being no insurance, indigent type of individuals who have, in a lot of cases, have severe medical problems that are unattended to.
Ruth's Place Clinic couldn't have a budget that could cover all the volunteers that we have. We have retired nurses, we have retired nurse practitioners, obviously the volunteer doctors, the administrative staff. In addition, we have a wonderful relationship with Tarleton State University, and we have nursing students rotate through.
I brought my students here and they just loved it. It's like a relationship on both parts. We help Ruth's Place, and then Ruth's Place gives them an opportunity to filter through and, you know, gain that kind of knowledge in adult medicine and pediatrics.
I came and volunteered and I fell in love with the place, and it gives me an opportunity to work with kids and to serve others and use my nursing skills at the same time. So it's great practice and a lot of fun.
Our students have learned so much with working with the underinsured, the uninsured, and just having a chance to practice hands-on with real patients in the community setting.
It's really community supported. We have volunteers that help with everything here. There's very few paid staff here. Almost everyone donates their time. The doctors, the nurses, even people that help do the yard work, the construction, that this has really been a wide effort. And it's not just from one person. Many times you'll have an organization, there's one primary donor that kind of funds it all. In this case, it really is widespread, and the whole community is behind this.
I've gotten so much out of this facility. Sometimes when I go home and I'm having a bad day, all I think about is here, how we've made a difference in some other patients' lives.
What I find in volunteering is, well, first it's time for me to give back, but also I get a heck of a lot more out of all this than I give.
Anybody I can help is self-satisfaction, and there's no substitute for self-satisfaction.
You know, you really feel good about yourself when you're able to pay all the good things that you've received in your life forward to other people.
It's just amazing to see how wonderful humanity really is. You watch the news and things seem terrible, but you come out and you get involved and you be the hands and feet. And it's amazing the impact that other people have on you. People volunteer thinking that they're going to give something back to the community, but always it ends up being the opposite way. The community gives way more to you than you give to them.
Hood County has always been able to see a need and then step up to the plate. I feel that Hood County cares about their community, they care about the people in their community, and they always step up to the plate to take care of them, especially the children.
Living in Hood County, it's just being a part of a community, a caring, giving community, one that sees a need and comes together to fill that need. It's a great town.
The United Way of Hood County has been instrumental in seeing Ruth's Place become a reality. From overseeing operations and funding to coordinating the efforts of volunteers, businesses, churches, partner agencies, and local charities, the United Way has brought together a community enthusiastic about this effort to address our society's healthcare challenges on a local level. And it's all because you care. Your gift to the Hood County United Way supports Ruth's Place Clinic and the efforts of so many other local partner agencies that help us take care of the needs of our own community. So come and be a part. Support the United Way of Hood County, coming together to make a difference.